Hi everyone, my name is Ketra Pori, and I will be sharing with you my final project for this class, which was creating an algorithm to address the lack of integration within EPIC, which is the electronic health record that I work in through my employment with Lancaster General. Do you get frustrated feeling as if the questionnaires you give to patients are not found or used by others on the treatment team? Scores to questionnaires fall into many different places within EPIC. By creating and implementing an algorithm with the help of IT support, all scores to behavioral health screeners can be found in one easy-to-find location in EPIC. This will help any medical or behavioral health provider easily find patients' answers to these screening tools. Rather than wasting valuable time calling the help desk, feeling like you're endlessly clicking around in EPIC, or becoming frustrated with not finding these scores, put in a ticket today with IT support to get this algorithm created. The development for my idea from innovation really came from hearing complaints from coworkers. And so the complaints about a lack of integration within EPIC were really abundant and came from new hires, came from people who have been working on our team for some time. And one of the main frustrations is how the assessment scores that we are responsible for giving to patients are not housed in one central location, making it difficult to determine when was the last time this assessment was given. And so the same issues had happened previously in years past, but the IT department had worked to solve this issue. And so what we have been finding in the past 6 months is with the increased use of technology, like the use of iPads, kiosks, and different apps that Lancaster General has developed, this problem is occurring again. And so what is happening whenever an assessment is given to a patient, their score and the answers to those scores come from that device or application and are electronically sent to EPIC. And so once they get to EPIC, they're not being housed in the same spot, which makes it difficult to determine when's the last time a patient actually was assessed. This frustration is definitely felt by those in our department because we are required to give certain assessment tools to patients each month when we are seeing them. And so we're much more likely to miss or forget to do these assessments if we do not accurately know when's the last time this was given. This also can interrupt billing, and so we're looking at ways to start billing for giving these assessments to patients, and so there are stipulations for insurance companies as to how often we can bill them for doing these assessments. And so again, we don't want to be, charging insurance companies more than what we rightfully should. And so again, it's just one more reason as to why we need to know when's the last time this assessment was given. The research that I conducted in this class really only found one possible solution, which is something called the Behavioral Health eSuite. This was created specifically for a research project, and it was capable of integrating into EPIC. However, the use of this type of application or something similar is likely too expensive and too time-consuming for Lancaster General to invest in it. Lancaster General really wants to use the technology that it has available and just make it and be able to use it in a better, smarter way. And so some brainstorming that I did with some peer feedback led to some possible solutions, again, like using what we already have. So the different applications that we have, like My LG Health, as well as just trying to enhance the current algorithm to make sure it is including all of the different ways that these scores can be inputted into a chart. My idea for innovation does fit into the framework for innovation. So with regard to quality of care, being able to accurately determine when's the last time this assessment was given can lead to better treatment options, especially for those patients who score positive on the screening tool. Costs can also be impacted. We can get more reimbursement from insurance companies for giving these screening measures, which we're already doing. Let's get reimbursed for the services that we are already providing. It can also increase safety. Scores to the screening measures can provide insight into depression severity and suicidal thinking. Depending on the outcome of those scores, that may impact our push for a patient to go to a hospital. It can also affect efficiency, so providers don't have to spend countless minutes searching within a patient's chart or trying to call the help desk to determine when's the last time that this patient was assessed, which can lead to more face-to-face time with patients. And lastly, it can also impact outcomes. The patients can receive more timely treatment based on their current symptoms that are represented in those assessment scores. For this idea to become a reality, the main resource that I would need would be my manager would have to approve the idea and basically give me permission to place a ticket. Placing a ticket basically sends a notification to the IT department that this is a problem that needs to be solved. And so funds from our department would be allocated for the IT department to work on fixing this problem. And so I can report as of today, the approval from a manager has been given and the ticket has been placed to try and resolve this issue. And so then the IT department will have to designate resources to determine what's going wrong, why aren't these different parts talking to one another, and determining what needs to change to the algorithm so that they can start talking to one another and these scores are in one central location. The one thing I will say is based on some past tickets that I have placed in, this solution could take weeks to months before it is finalized and implemented. All right, that is my presentation, and I hope everyone has a fantastic summer, and thank you for listening.